This is Going Under, Anesthesia Answered with Dr. Brian Schmutzler, a very happy Hoosier, Dr. Brian Schmutzler.
Who? Hoosiers?
Got the job done. I am Vahid Sadarzadeh, and this episode of Going Under, as all of them are brought to you by the Butterfly Network.
Not by IU.
I mean, if we want to get Upland Brewing Company in here, yeah,
true,
sure.
That's true. All right. I'm going to let you in on something that's completely changed the way that I practice. I've been using Butterfly probes for years. It's a portable ultrasound that plugs right into my compatible smartphone or tablet, so I can start scanning at the bedside in seconds. If you've used the older versions, or even if you're new to the handheld ultrasound game, let me tell you something and why this new IQ3 is a game changer and really impressive. First off, having an ultrasound that literally fits in my pocket means I can move faster, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this tiny device is pretty incredible. Biplane imaging lets me see short and long axis simultaneously, which is huge for procedural guidance, and honestly, a great tool for learners. The new needle out of plane preset even shifts the scan plane digitally, so I can see the needle tip sooner, which makes a real difference when precision matters. And the image quality, honestly, the IQ3 holds up against some of the high-end cart systems I've used. That's impressive for something this portable. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special offer. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com.
The Hoosiers get it done.
Hoosiers?
I was right on a low-scoring affair, but...
Not really. It was 27-21.
7-21.
That's not really low scoring.
I guess so. No. The over-under was like 46 points. 40. So it was very close to the over-under.
But they did not beat the spread. I think the spread was 8.5.
Correct.
Yeah.
And I did say under the spread. I was right there, but...
And no offense to Carson Beck, because I think he is a very good quarterback, but Carson Becked that last play.
Yeah. We talked about it.
Yes,
when is he going to Carson Beck?
When is it going to happen?
It was on the last word.
And I saw a meme today that said that of his 6 losses as a college starter, 4 of them came on an interception he threw in the last minute or 2 minutes of the game.
Well, congratulations to Hoosiers everywhere, to IU fans, graduates, and the like.
Shout out to my dad, who had passed almost 6 years ago now, but loved IU. He would have loved this. 2026 would have been wonderful for IU for him. So,
yeah, that's awesome. Shout out is awesome. And today on the podcast we are dealing with school policy.
Yep.
But
not this school.
Not that school policy.
Indiana.
Schools in general.
Public schools.
Public schools. Yeah. And I'm not sure why it's much of a debate. But it is in front of the State House as we speak.
Money, right? I mean,
money,
the answer is money. Now tell me what the question is, right?
You always say that.
That's right.
You always say that.
Yeah.
And it probably is about money. Mm-hmm. But right now in front of the State House is a bill that, if passed, would give each school, an AED machine, a life-saving device.
So I think it's already law. I think they're going back and trying to amend that law in a bigger bill. And I don't know exactly what. I mean, it's House Bill 1004, but I don't know exactly how how it's being laid out. But right now, every school, and I'm reading this off the website here, has to have an AED. CPR trained staff and a plan for cardiac arrest. So, and that's not just the school. That's like the sports fields and the gymnasium and the performing arts center and all that kind of stuff.
We're going to get into a lot of the specifics here, but how, generally speaking, how much is that to have a person on staff training? And do you have to change out the AED every once in a while?
I think you just have to test it and change the batteries. So, I mean, man, the last time I bought an AED was probably a couple of years ago, and it was maybe, I don't know, $3,000 or $4,000. Okay. I mean, that's not the thing
that's going to take a lot of the cost.
Yeah, I mean, you get to have somebody always trained in CPR. You're going to have somebody there.
I mean, should the school nurse be already trained in CPR?
You can't ask the school nurse to be at all events at all times, right? So somebody's going to have to be there. So that may be part of the logistical problem of it. And I have, you would imagine that somebody that's at the school would have some sort of CPR training, whether it's a parent or somebody who's there. I guess my bigger issue is why not have the AEDs, right? It's a one-time cost. And you and I even kind of talked about this earlier. Like, I guarantee that I could get together a fair amount of physicians to pay for this for, a lot of these schools, or at least raise the money somehow to pay for this for the schools, because AEDs are critical. They're life-saving. So, I mean, that part, there's some costs on the front end, but not recurring costs. Having a plan for cardiac arrest doesn't cost you anything aside from a little bit of time to make that plan. Maybe the cost comes in with the CPR trained person available at all times. And I haven't, in full transparency, I haven't read all of the bill. So some of this I may be not totally accurate on, but at least this is the evaluation of the bill that I've read from a couple different sources. So
let's just go back to the basics here. What is an AED?
Yeah, an automated I just call it an AED, a defibrillator, basically, right?
Automated external
defibrillator. Yeah. So what that means, and you've seen this on all the TV shows, ER and whatever. We don't use big paddles anymore and shock you, right? We tape them on, but basically, when the heart stops, there are certain rhythms when that heart stops, meaning what the heart's doing or stops pumping, that we can use this device. And the device basically provides a shock on the outside portion of the skin or the body that then shocks that heart. And so cardiac arrest, outside of hospital cardiac arrest, with only CPR intervention, right, has about, the studies vary, but 3 to 7% survival rate, okay? You add an AED in there, and the survival rate skyrockets.
You just said heart attack in general?
Cardiac arrest.
Cardiac arrest.
Yeah, not just heart attack, any sort of cardiac arrest. Out of hospital cardiac arrest. Now, if you're in the hospital, you have a much better chance because you got a bunch of people around who know what they're doing and a bunch of devices. But out of hospital cardiac arrest, witness cardiac arrest with CPR only, has a much lower rate of survival than if you have an AED, because oftentimes, especially in young kids, right? Or young adults even, it's not usually a plumbing problem, meaning they don't have a heart attack because they have a blockage in the arteries in their heart. They have an arrhythmia that causes the heart to either beat inappropriately or to not beat at all. Okay, so that's typically what happens with kids. And the best way to fix that is not to make the heart, pump with your hands. The best way to fix that is to reset the electrical system in the heart. And the way that you do that oftentimes is an AED. So it looks like, so this was all stemmed from Jake West, who was a teenager who collapsed at a high school practice and died in LaPorte, Indiana, I believe.
Jake's Law.
Yeah, so it's called Jake's Law, was the original. So, yeah, and there's been a lot going on in the media. There's been a lot from the American Heart Association supporting this. As a physician, I 100% support having an AED, as many AEDs as you possibly can have anywhere, right? Like, we have AEDs in the airport. If you have a gym, you have to have an AED. You walk into Walmart, there's a couple AEDs on the wall. Like, we should have an AED in schools so that kids are able to have a better chance of survival if they have a problem. And again, I understand if it's a cost thing. I think, and I would call any physician out right now that we put together a group of physicians who say, we're going to pay for these AEDs, right? So if it's a cost issue and that's the problem, I'm willing to spearhead a group to try to get those for everyone.
You sound like you're ready to run for office over there.
Just stop it.
But
it is citizen.
It is more than an issue, though, of just healthcare, right? It's
correct.
It is an education issue. It's a policy issue.
Yeah, it's a financial issue for sure. Yeah.
And if you're the American Heart Association, right? I mean, we have talked many times about these associations, right? What is the job of the American Heart Association?
Well, it's supposed to be
to educate,
to educate and to promote cardiac health, and so that not only means, recommendations for diet, recommendations for exercise, recommendations for for all kinds of things heart related, but it also means recommendations, and they actually put out the guidelines for CPR, and it's called ACLS, or acute cardiac life support, right? Okay. That's what happens when you have a highly trained person, nurse or somebody in healthcare who's using AED and knows all that stuff. That's more than CPR, more than basic life support. It's advanced cardiac life support. So
If you're a citizen, though, right? Like, let's say I go to the games or whatever, right? And I'm the
CPR.
announcer.
Just do CPR with your hands.
Could I be trained in this device?
You could. I mean, you could do ACLS training, and people get trained in ACLS. Most people in the general population
Do not.
right? If you're going to get trained in anything as a general, right, you don't have a medical background, you are announcing at an event. If you're trained in anything, you're probably trained in BLS, basic life support, and what that really consists of is chest compressions. That's the most important thing, and then mouth to mouth or providing some sort of oxygen. Although now the AHA is recommending just hands only CPR, so just doing compressions.
Gotcha.
And what that does is it compresses the heart enough to push blood out, and then releases it and brings blood back into the heart, and then pushes the blood out and releases it and lets it back in. And so that pushes that blood, even though it doesn't have a ton of oxygen in it, it pushes that blood to the brain, to the organs, all the things that the reason the heart even is present in the body is to pump blood, which carries oxygen to all of the critical organs.
Is there a danger in that as a citizen?
Doing basic life support?
Yeah,
no, not really. Older, frail people sometimes have broken ribs, but that's usually not a problem.
But not for the person trying to administer it in terms of,
No, maybe you get some sort of like carpal tunnel from it or something.
I think I'm talking more along the lines of law-abiding citizens, right? Like,
are you
let's say
concerned
you
that
don't.
somebody's going to sue you? Is that what you mean?
Right.
Yeah. Yeah, so if you're a law-abiding citizen, you go to help somebody, I don't think that there's any way that you can be sued for that if you do it in good faith. Depending on the state, there are Good Samaritan laws. So some states, let's say I'm a physician in one of these states, and I don't remember, it changes all the time, but let's say I'm a physician in one of these states and I go to help somebody, and for some reason they don't survive. In a lot of states, I'm protected because I was a Good Samaritan. I was just out on the street trying to help somebody. In many states, though, I'm not protected. So that person could then say, oh, that's a physician. He should have saved me and done blah, 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 blah. I'm going to sue him. Now, does that mean I don't go help? No, of course not. I go help, right? But there's some risk for me. There's really no risk for you.
Okay.
Maybe the only other risk, and the reason they went to hands-only CPR is there is a very, very minute risk that if you were to do mouth-to-mouth, you could catch some sort of illness from somebody's saliva. It's incredibly rare. I don't know that it's ever happened that I've ever seen in the literature, but people are afraid of that. So
I think the most shocking stat, though, is the difference if you have this device, whether it's or if you don't have this device.
Especially in a teenager or a young adult, where it's most likely an electrical problem, not a plumbing problem.
We see this in sports, right?
Right, correct. Yes. And so that's key. If you can shock the heart with an AED, a lot of times you can get somebody who's otherwise young and healthy but just has an electrical problem in the heart back. So
not just Indiana, though. I think this is, from hearing about this, shouldn't every school across the country have something like this? Is this...
I would argue that they should, right? And again, I haven't dug in deeply to the cost of any of this sort of stuff, but if you're talking about one of the most potent things to help somebody survive a cardiac arrest, the AED is that. It's like having epinephrine if you have an allergic reaction, right? These are just things that you should have around. Narcan, right? Narcan became over the counter, right? So all the police officers, all of the EMTs and paramedics, they carry, now it's nasal, but used to be, an injection, but they carry Narcan with them. I can go to the store right now and get Narcan if we wanted to, right? To help somebody out if they were having a opioid overdose. So, just like Narcan, AEDs are very, very, very important.
Heart disease, heart attacks, the number one killer.
Yeah, I think it's still number one. Yeah.
Yeah. So I think it's important.
Very.
Yeah.
Very. And so I guess what's happening right now, it was tagged on, the changes were tagged on to some House bill. I think there were some changes to it that kept those rules in. It's hard to tell exactly what's happening, but I guess.
And then the changes passed. Something passed today.
I think the bill went out of committee with the keeping things the way they were for the AED and the CPR. I could be wrong on that. It's hard to tell exactly based on what I'm reading, but I think that the House or whichever committee it came out of understood that this is a critical thing for high schools. And so, I mean, bigger issue is like what kind of things are we as a society kind of required to have around, right? So, and I don't know the answer to that, but at least I know that AED is a good thing to have, and it's not that expensive, right? It's not hundreds of thousands of dollars. It's thousands, maybe tens at the most.
Some important things going on at the State House right now, some important discussions being had. So we encourage you to go look at that bill and what's being presented there, because I think it is important that every school have one, or at least have the conversation about having one.
Have you ever done CPR on anybody? Personal?
No,
personal
I have. So I was a lifeguard.
Okay, yeah. You probably had to have the training.
Yep,
then.
and then I did receive my certification to be a USA triathlon coach and swim coach.
BLS for that, sure. Yeah.
Yep. So I have done it. Not on a live human being before. And I hope I never really have to.
Yep.
But if I have to step in and do it,
you would.
I would.
Yeah. So they changed the the book like every 2 or 3 years or 4 years or something. So they changed like ratios of compressions to breaths and all that kind of stuff. They changed that constantly.
But it's something. If you have certificate, you got to get it.
You have to recertify every 2 years. Yeah, correct. So. There's some interesting change, and I complain every time I have to take it, right? Like this is what I do for a living, so it's not like I don't know how to keep somebody alive. But anyway,
it's good to have that training.
It's good to have that training. I mean, there's some other stuff out there too, aside from just BLS is that basic life support, just CPR. ACLS, acute cardiopulmonary life support, adds the AED and some other drugs that you can give and that sort of stuff. Then you have PALS, which is pediatric acute life support. There's some different things with kids. Oxygen is the biggest thing. When a let's say a 5-year-old or younger has a cardiac arrest, it's usually because they are not getting enough oxygen. So a lot of things we do for kids is just get them more oxygen. Then they have ATLS, acute trauma life support, which is a whole nother level. I'm not even ATLS certified, but the ER docs and the trauma docs and the general surgeons a lot of times who do trauma are trained in this, where it's additional things, right? It's additional layers of, okay, how do you stabilize somebody's injuries? What do you when do you send them to CT scanner? Blah, blah, all that sort of stuff. So,
Awesome.
Yeah, very interesting. So.
Well, we'll
keep track. We'll keep track of this because I think it's a big deal, and I don't have any skin in this game aside from just being a concerned physician. So
that's enough. That's a lot of skin in the game. I will say that.
Fair enough.
We are brought to you by the Butterfly Network, and if you have a question or comment, link it below, and Dr. Brian Schmutzler will answer your question.
Yeah.
All right. Thank you so much, Dr. Brian Schmutzler.
Thank you.
Going under, Anesthesia Answered, brought to you by the Butterfly Network. I'm Vahid Sadrzadeh, and we'll see you in the next one.
We will.
Go Hoosiers.
I mean, it's already over.
Yeah,
so no more go Hoosiers. It's nice job, Hoosiers.
Yeah, nice. They won one before Notre Dame.
Oh. Yeah.